Hi, I'm Toby, I'm 35, and my own body seems to be trying to kill me. Today I've come to this absolutely beautiful and very peaceful park. It's a place I like to come to unwind a little bit and to get out of the house, particularly when things have been a bit overwhelming. And at times when I've really struggled to get out of the house, which is something that has been happening recently. Why? Well, today I'm going to talk a little bit about fatigue. Since my most recent hospital admission, my fatigue levels have been very high. I've found it very difficult to do basic things. It's been impossible to get into work on a couple of occasions. I've just felt physically and emotionally completely drained by simple day-to-day tasks. It's even reached the point where I can't read or watch TV or anything, the kind of things you usually do when you're exhausted. You can just sit there and unwind, and even those things have seemed like too much effort. Fatigue is probably the most common symptom seen in patients of liver disease. Recently, Dr. Craig Lammett of the Autoimmune Hepatitis Research Network, led by Indiana State University, said, "In my liver practice, I have heard so many stories of how fatigue can ruin relationships, destroy a sense of identity, and even topple aspirations." It's a well-recognized symptom, side effect of liver disease, but it's not very well understood. The mechanisms behind it are not very well understood. It's not very easy to measure on a patient-by-patient basis. And a lot of doctors and a lot of liver specialists ignore it somewhat in favor of focusing on the more concrete symptoms that they can deal with. This can sometimes leave patients of liver disease in a situation where they're not receiving advice or even just a general affirmation that would help to know that this is a common symptom. It's something that everyone is having to deal with, and you're not kind of strange for feeling exhausted all the time. In fact, although my liver clinic is absolutely excellent, it's one of the things that they didn't really talk to me about very much, and I only learned through talking to other patients and doing some research myself that it's such a common symptom, and that my levels of fatigue were actually very much par for the course with this disorder. In fact, it's such a predominant symptom that it's often the first symptom that patients will come to their medical specialists for support with before they've even recognized that they have a liver disorder. It doesn't help that fatigue is so varied and unpredictable across liver disorder. It seems to be more common in some disorders, such as autoimmune hepatitis, and less common and less severe in viral hepatitis and viral causes of liver disease. Also, the causes or the exact mechanisms behind this fatigue are not well understood at all. There are a few theories, but nobody seems to be absolutely certain, as with a lot to do with autoimmune hepatitis, exactly how this happens. On a more day-to-day approach, one of my favourite ways of describing the fatigue levels is with what's called the spoon theory, which originally came from a description of fatigue in lupus, I believe it was, but has been picked up by a lot of people talking about mental health and chronic disease in general. And with spoon theory, imagine you start the day with a certain number of spoons, and each task you perform that day will cost you some spoons. So getting out of bed might cost a spoon, having a shower might cost 3 spoons, having breakfast might cost a spoon, and so on. So if you're starting the day with maybe 20 spoons, you have to really think about what you're going to prioritize that day, because once you've run out of spoons in that day, that's it, and you've reached the point of exhaustion. You've got no more spoons to give, and you cannot function any further. Another measure that I like to apply is quite simply a percentage. So on a day-to-day basis, I will look at how I'm feeling and think, I'm about 25% today. So it's just a very quick finger in the air idea of saying, this is the kind of energy levels and this is the kind of mental state I'm at on a day-to-day basis. So on a good day, generally, I can be 90 to 100%. On a particularly good day. On a bad day, I can be as low as maybe 20%, which means I've literally got the energy and the motivation to get up and go to the bathroom and sleep, and that's probably about it. Fatigue is generally split in the medical literature into peripheral and central fatigue. Now, peripheral fatigue is described often as kind of your muscular fatigue. So it's feeling weak, feeling like you don't have the ability to physically move. Fatigue is generally split in the medical literature into peripheral and central fatigue. Now, peripheral fatigue is described often as kind of your muscular fatigue. So it's feeling weak, feeling like you don't have the ability to physically move. This doesn't tend to be so prevalent until the point where your liver is decompensated. Now, decompensated liver means that your liver is so damaged it's unable to perform its general functions effectively. And the liver is very important in supplying energy to the rest of the body. It converts a glucose to glycogen, stores it, and then can convert it back again when your body needs energy. When your liver's been damaged so badly that it's reached cirrhosis and is decompensated, it is unable to perform this conversion very effectively, and it also has less space to store that glycogen. That's due to the cellular damage that happens with cirrhosis. Central fatigue, on the other hand, is linked to the central nervous system and is described as being related to difficulty initiating or maintaining tasks, increased effort for tasks, and self-motivation. It's been linked to neurotransmitters such as the corticotropin releasing hormone, dopamine, and serotonin. Now, those of you who have any involvement in mental health may notice that these are hormones or neurotransmitters that are linked to things like anxiety and depression and often targeted for treatment for anxiety and depression. These same neurotransmitters have also been related to chronic fatigue syndrome. So there seem to be definite links between liver disorder and anxiety, depression and fatigue, even if those links are not fully understood, i.e. the mechanisms by which they work.